In my recording, I hope so. Start soon. Yeah, there it is. I heard that. All right. We'll start over here. Uh, so for those that either listen to it or were listening online on Friday morning, we completed the physical methods of control, and now we're into chemical methods of control. And we certainly use more of those, I think, in everyday life than anything else, and certainly from whether you're at home or a professional perspective, you use a lot of them, and you're going to see that historically we've used ones in solid state. We certainly continue to use things that are gaseous, but mostly I would say we utilize liquids. And then the distinction is whether they are considered to be disinfectants or antiseptics, or depending on their concentration, the type of usage, they're considered to be both. And you'll see different names that are associated, certainly historically. Aqueous, it basically means dissolved as a solution, dissolved in water. Historically, though we don't necessarily see them as much, though you'll probably hear about them, are called tinctures. A tincture just means that something that is dissolved in at least 50% alcohol. It doesn't have to be all alcohol, but at least 50%. And historically, tincture of iodine and tincture of merthiolate been around for a long time. And there are others, more exotic tinctures in the apothecary world. The apothecaries were sort of the predecessors of the pharmacists, and actually had their uh, historically had a very interesting perspective, and there was a lot of topical agents that had some very interesting ingredients that I used to call kitchen sink remedies, because they threw everything in there but the kitchen sink. And I actually used one at work called husk ointment. It's pretty interesting. Nevertheless, so what are the desirable? And again, there's no panacea. There's nothing. There's something. It's the oldest story in medicine, and the oldest story in science and taking care of patients. There was one best thing, we'd all do it. Okay. And that's really what it is. If there's one thing that everybody does, a procedure, we all do the same procedure. I mean, today, basically, let's say if somebody has a torn medial meniscus in their knee, typically it's an arthroscopic procedure. Everybody basically does the same procedure. So when you have something that works regularly and consistently, that's what you use. So these are the things that you're looking for in a variety, whatever the germicidal agent, that it works relatively rapidly, even and preferably in small concentrations. Okay. It has long term stability, and that's not always the case. It has a broad spectrum, which means it covers a wide range of microbial entities, whether it's viruses, gram positive, gram negative, and preferably without being toxic to human or animal tissues. Not a whole lot of that going around either. Penetrates well into inanimate objects, has a layer or has a residue that persists in action. The trouble with those things is they typically, when you have things that persist, they're unpleasant when they get onto the skin. They're useful in contact with organic materials. That's that whole nugget about cleaning off instruments. When you have a lot of junk on there, it's very hard to penetrate it. That's why phenolic compounds were used by Lister originally. They work relatively well with organic matter. Good news. Bad news, we see more problems with them with long-term, uh, basically we notice them long-term accumulating in organs. And that's why a lot of them have been sort of removed, even though there's topical agents that utilize it. Not not a lot of those are non-staining. The stronger they are, they have that problems. Yeah, the sanitizing and deodorizing properties are something that you can enhance that, not necessarily there in affordability and availability. Those are all multiplications. So you might not think of that. And I hate to teach. And when I talk about you don't want to put a price tag on being able to use the best agent. But the reality is that's a consideration. That money is a consideration. Long before you guys were around, I mean, I had patients back. I started treating people in 1979. We didn't have a program that assisted prescriptions whatsoever. That came shortly thereafter in the Commonwealth of Pennsylvania. I mean, I had people who had to decide whether to buy food or get a prescription filled. So I mean, because I had a lot of patients who were very old and had Medicare, and that was about it. Okay, and lived on whatever Social Security could afford them. It was. I can remember to this day. My first wife and I saw this lady, who was one of those people who were older, who weighed less than her age. Bertie Miller. Okay. And we're shopping in a little supermarket called an IGA, which stands for Independent Grocers Association. And I know she doesn't have a cat, and she's buying a lot of cat food. That's sad. And my first wife's going around throwing stuff into her shopping cart after she paid for it. God bless her. Oh, God. Long time ago. That was like 1980. Okay. It's a while ago. So all of those things we don't quite have the consideration now, but it's real. I mean, how many disposable dollars does everybody have? And in a global sense, hospital-wise, a lot of those decisions, there was a big decision made, as we'll talk about, chlorhexidine, when UPMC shifted to chlorhexidine, because at that time it was very expensive, comparatively speaking. But once they shifted, once the 800-pound gorilla makes a change, then everybody else follows suit. It's just the way it works. Okay, so high level endospore, and that's really the ones that we're interested in from as useful as a sterilant, something that's sporicidal. Intermediate fungi, but not endospores, resistant pathogens environment. We use a lot of those. Low level is something that we use routinely, but have to understand the limitations. And to me, I'm not going to ask you what's a high level, but I'll ask you what's considered a sterilant or what is not, and that's whether or not it can address endospores. So we look at the microorganisms, we look at the material, we look at how contaminated it is, we look how long it's been exposed, and we look at the agent. So those are all factors that are involved, if you want to think of it this way. For those of you working in a hospital environment, we're going to try to obtain the highest level of either disinfection or antisepsis possible that are there. In our everyday life, it's a little bit different. Okay, yeah, it's a dish. We just used it. I throw it in the dishwasher. We'll just clean it off with some dish soap. We'll be fine. And it's probably true. As to whether or not you're going to put it through a run in the dishwasher, we don't really have enough for a load. All those types of considerations that are there. And this is an interesting chart that this textbook utilizes, which gives you an idea about the length of time. We're going to hear a lot today about chlorine and bleach. And bleach is very desirable, but don't think for 1 minute that when you spritz down in the lab, and you're probably spritzing down the table with some bleach either before or after, when there's something that's there, that's what you should be doing, that's a diluted bleach solution. That is merely a disinfectant. That is not sterilizing anybody's lab table. If you want to use that, look at the amount of time. You need hours. Chemical agents, liquid chemical agents, take hours of exposure to sterilize. So you're just disinfecting it, and that's great. Then you got that residue on there, and preferably it's a good idea to wipe that off with something else as well. Because you don't want the next person who comes into the lab, you're going to have done it at 1 o'clock, and someone's walking in there at 1:15. A lot of those labs, we're not quite as crowded now as we used to be. And you put your bare skin down on the residue of the Clorox. It doesn't feel good. Just saying. So here, hepatitis A, naked virus. Protozoan cyst, tuberculosis, relatively quickly. Alcohol. You'd have to soak something in alcohol, and you're talking about 95% probably ethyl alcohol for 10 minutes, E. coli for 2 minutes. Naked virus is 70% concentration. So that's rubbing alcohol. We don't do that, do we? Peroxide. Now, 12.5 seconds, 0.3 seconds for gonorrhea. Very, very easy to kill gram-negative organism that's there. Even viruses, okay? We're still talking in terms of seconds, so peroxide is pretty effective. We use a lot of these quaternary ammonium compounds that are there. Again, you're not being so much destructive as removal, and then we'll get started on ethylene oxide gas. So that the way they present this tabularly is a little busy, meaning, okay, halogens, and the two major halogens are chlorine and iodine. And so you have the target microbes. This doesn't really, iodine is really not used as a sterilant. Chlorine is, whether it's in liquid or gaseous form, mode of action, indicators for use, blah, don't like it. So, without further ado, I go back to my comfort zone, which is this, which is being, and it really is the same thing. This is the Nestor PowerPoint. So I like to flip back and forth because some of the graphics are better and some of the explanations are better with both. That's the way I do it. I don't know what other instructors are doing, but you're stuck with me. Even I'm stuck with me. So we really tell you the same thing. Side note, disinfectants are regulated because they're about inanimate objects and they generally have some aspect of environmental activity potentially. They are regulated by the Environmental Protection Agency. Whereas things that are antiseptics or are utilized on living tissue are part of the Food and Drug Administration. It's good to know whose rules apply with regard to those things. So, dilution, temperature, duration of time, very important. And so, and obviously, they have to be clean. I keep making the same point. This is the same type of things that are there. So, whatever the particular standards are, you can see with regard, and it's the same thing, how toxic it is, whether it works with organic material, compatibility, is there a residue, cost and availability, storage. One of the early ones I'll tell you about is something I use in the office all the time. They come in concentrated forms because most places don't have a lot of storage for multiple gallon jars that are there. So a lot of things come concentrate. In concentrate, you dilute and you activate that are there. And then environmental risk. And so it's interesting, as an aside, when you hear about green agents are expensive. They're very desirable because you don't have, I mean, it's sort of like in the old days where people used a ton of window cleaner and they had those horrible fumes that were associated with it that were there. And now we utilize more green agents for that type. Imagine in a hospital with people with respiratory problems. So I mean, all of these are considerations, what floor they're using it on, what is one of the most important hospitals in the country. Basically went all green, but it was a lot of expense. That's Hackensack Medical Center in northern New Jersey, just outside of New York City. That's a big, big player. Here we go. Alcohols. That's right. Wonderful little Purell dispensers, been around forever. The thing that makes it important and the thing that limits it are the same. And it's coming up right away. Evaporates quickly, limiting contact time. The beauty of those hand sanitizers, get their hands are dry. You're not going patient to patient with wet hands. You're not dripping stuff on the floor, and that makes fall risks. Much less a mess, and people don't like seeing a mess that are there. Okay? All of those things are great. That's the good news. The bad news, evaporates quickly. So, I mean, you take that alcohol swab and you wipe off the skin. You've cleansed it off. Soap and water would be just as effective. It's going to be recontaminated before you know it. It doesn't take any time at all. Why do we use it so much? Because it evaporates quickly. It's easy to use. We're comfortable with it. There's no stigma attached to it. Like I said, you're watching somebody doing this with their hands. You're like, oh, I love that person. I can get close to them. You know that. Absolutely. It's crazy. So what is alcohols? Generally are in this region, 60 to 80%, typically aqueous solutions, most time because it's less expensive. They're using isopropyl alcohol, vegetative bacteria and fungi. Naked viruses and endospores do not need to apply. This will never in its lifetime be a sterilant. Okay? The nature basically penetrates major. I don't care about that. Alcohol is less effective. Proteins are more soluble in water. I'll buy that. So it's good that it's diluted a little bit. Commonly used as an antiseptic, not a disinfectant. Environmentally friendly, it evaporates quickly. Inexpensive, it evaporates quickly. No residue, it evaporates quickly. Okay. There is some damage. Okay. We use it a lot historically, certainly in tinctures, because some things dissolve much more efficiently in alcohol, and indeed, to some extent, their abilities are enhanced by the combination that are there. So that we probably use that more commonly than anything else, but you be aware of its limitations that are there. Aldehydes, the exact opposite. Aldehydes are have a problematic residue, but they are steroids. Okay, for years, the original aldehyde, and this is part of today's discussion, formaldehyde. That was one of that from a organic chemistry basis. That's like the first aldehyde that you can make. Okay, if you've taken organic chemistry, have some background in it. It's like that's the parent of the aldehydes that are there. We've used it. It's been around forever. What do we utilize for the longest time in surgery? When you remove something you want to send into a laboratory as a preservative, you plop it in a little jar with formaldehyde. That immediately preserves it, and it starts to act upon it and makes it easier to process in the lab so that you can look at little slices microscopically. It's nasty. Okay. It dries things out horribly with its residue. We used to take it and dilute it into a good smelling water called rose water, because it had essence of rose in it, and use that topically for people with certain kinds of skin problems, particularly something called hyperhidrosis, where they perspired excessively. So nothing unusual. You put a lot of things in rose water to obscure the scent. Where was formaldehyde initially used, and where is it still used, even in some preparations, though less so today? It acts again as a preservative. It was one of the early preservatives. This could bother you because this is a toxin. That's part of today's discussion. Vaccines. Preservatives in vaccines cause problems. Be aware of that. I try to be less political than possible, but right now people are vaccine crazy. There are preservatives in vaccines. So it's a sterilant. I mean, I understand that the amount that's going in there, and I'll comment on that, is very minor, but minor in babies is a lot different than minors in UNI, than minor amounts in UNI. The one I use in the office all the time for years, for 20 years, is glutaraldehyde. We all did. It's a cold liquid sterilant. It comes in a tiny, most of it, like you saw with a bleach bottle, most of them have, have a coated to avoid sunlight, because sunlight will deactivate them like bleach does. And so the glutaraldehyde is in there. Here's what my staff did every morning, because once you activate it, once you dilute it in the appropriate amount of like distilled water, at that point in time, it has a 24-hour lifespan. So the first thing my staff did when they came in is they have to change out all the solutions. We put the instruments, they soaked in it overnight, and you put a new unit in immediately. So you could basically instruments that you weren't using, you could put right back into a cold sterilizing solution. When you took them out of what's called a barred Parker tray, it's got a little, you lift it up, the solution drips off, then you take it out with gloves on, wipe it off with alcohol or water, so you wouldn't have the residue that was on it. So it worked. So 2% alkaline glutaraldehyde, what it was, required overnight immersion to act as sterilization. Still very toxic. You have to rinse it off after use. Now they're using more of this ortho or orthopaldehyde, however it's pronounced, has an effect on the skin. And formaldehyde, been around forever, okay, kills microbes quickly, inactivates viruses for vaccines, preserves specimens, carcinogen. Just saying. So even though this is utilized a lot, particularly for in a liquid sense, it's not a great agent. This was kind of the agent that when they talked about like endoscopy tubes, they would put it in a solution that was like that, and then basically rinse it off and wipe it off before you used it, basically going down somebody's throat, into their down their esophagus, into their stomach, or colonically. The name of this category is, and again, very much opposite. This is one we utilize in the hospital all the time. This might be the most common hand washing agent. It's probably the second most common agent used for surgical scrubbing. And like iodine, betadine, which is the other agent that's in that category, it does better in combination with soap. Like some things, putting them in alcohol help. In other things, using soap with it works wonderfully. They're called biguanides. The name that you see most of the time, and the name in the other PowerPoint, are chlorhexidine agents. You'll see it. You can go right now to a pharmacy or Giant Eagle and get it right away. I don't know if it's on the shelves. The pharmacist will definitely have it without a prescription, called Hibiclens or Hexaclens. If you had a dental procedure, you're at that wonderful age where everybody's getting their wisdom teeth out, you know who you are. Okay? Time's coming. I see smiles. They give you, just like my wife did, because she had a dental procedure done last week. She's going to the dentist today. She loves going to the dentist. He's really good looking. Even I thought he was good looking. That's terrible. He's engaged, though. I told her she's out of luck. But Tom Brady's available, so she figures she's got a shot. Is Jimmy Garoppolo dating anybody? That's another one. We're not even Kenny Pickett. She would definitely be considered a cougar. It's okay. Nevertheless, okay. So she got it for like, it was like, I forget what the dilution was, like 2% or less chlorhexidine for mouthwash, which is the most commonly used. Why? Chlorhexidine is wonderful, particularly extensively used as an antiseptic. Its residue remains on the skin. Catheters, mucous membranes, low toxicity, as they say here. Basically does not have a tremendously broad spectrum, but it's very effective. Okay, skin creams, mouthwashes, all of them. If you see what we do in surgery is you get surgical sponges that have a little brush on one side, which you basically do your nails with to clean anything that might be underneath the nails, and the other side is a sponge. The sponge is impregnated, or you can put it on yourself if they have little pump bottles that are useful. Probably have a foot control on the sponge itself. Most of them come that way. There's one that has chlorhexidine because some people are more allergic to iodine-based compounds, and they have a little more irritation of the skin. This foam comes out sort of a white or pink color when it's mixed with soap. The betadine is sort of a golden brown kind of a color. As we say in cooking, GBD, golden brown, but in case of betadine, not delicious. That's what GBD means. Cooking. Chlorhexidine. Love it. That's my preferred agent. One of the labs I used to do with it involved the chlorhexidine to see its efficacy versus hand soap and antibacterial soap and punch soap and various kinds of pump soaps that were utilized. Okay, but it's been a wonderful category, and this was the agent that UPMC eventually switched to. Every time I would go into an emergency room with like one of my kids or somebody, I'm curious. I would look around and see, and they were still using the standard antibacterial soaps that most of us have at home. Okay. And then then maybe 10, 12 years ago, I saw the switch over to chlorhexidine because always in between the rooms, like an emergency room, they'll have, stations to wash for the staff. That's chlorhexidine. Ethylene oxide, poison gas, the most commonly used poison gas. When you go into the lab and you open up one of those sterile cotton tip applicators, poison gas. Band-Aid, poison gas. Go get pre-sterilized 4x4s or gauze of any type, poison gas. They put them into a room like this. There's effectively a gas chamber, already sealed. the gas is small enough that it will penetrate the paper that it is in and expose it for whatever the appropriate amount of time is, and then suck out the gas. So it's bulk sterilization of items that are moisture resistant and heat resistant, and we use it all the time that are there. Surgical gloves, probably poison gas. All those wonderful paper drapes, poison gas. So heat or moisture sensitive items, very effective. Most of them react with proteins, fabric, equipment, implantable devices. If you see someone with an artificial hip, the way that any artificial joint, or what we call a joint prosthesis, they come into the laboratory, I beg your pardon, to the surgery. The sales rep has a case of them that they bring in that are sitting there sterilized. The thing that they utilize in the operating room that they re-sterilize is a sizer. So it's like a rubber that you fit into the joint to make. I actually did do this stuff. As you fit into the joint to see if it fits, and then once you yank that out, then they open up that device, and they just transfer it to the table, and then they insert it. However they're going to go, whatever the modern techniques are for insertion that are there. Mattresses, electrical equipment, artificial hips, many disposable plastic petri dishes. They come bulk sterilized. Pipettes, we have sterilized pipettes, though a lot of times we use non-sterilized. Years ago, before the EPA got busy, when I started in practice, I bought a steam sterilizer, an autoclave, same size, was called a gas clave, and it had like a little gas cartridge, like a CO2 cartridge that you would use at home for something. Or you could use a little gas cartridge if you like to use one of those, like a torch, to a creme brulee. Food moment. Okay. Explosive, toxic, carcinogenic, and it takes a lot of time. That's what they found out, why you can't buy those anymore. Sterilant. The biggest single category. Halogens. There they are, right there on that periodic table in pink. Okay. Fluorine, chlorine, bromine, iodine. Yes, love them. So, one is a sterilant. That's the chlorine-based one. One is an antiseptic. That's the iodine-based one. Yeah, they all denature proteins and things like that. Chlorine-based products are typically used as disinfectants because they're caustic. Okay. You can get, and here's that white container again, because sunlight affects it. You can take a dilution of roughly, and I would say you're looking at maybe to a gallon of water, 3 or 4 ounces would be fine. It's 1 to 100, so you're covered. Because it is more effective when it's diluted. Whether full strength would be really problematic with regard to its corrosive nature. We use it and have used it for years, okay? And that was the original way that water was purified, when they found out that that cystic, and these are basically protozoan cysts, would survive. Then they had to modify. So it wasn't just chlorine. Then you begin to see usage of ultraviolet light. You used various other compounds that were there, modifications, and it made a much more elaborate process for dealing with potable water. Okay. It can react with organic compounds, even produce carcinogens, so there's some limitations. Okay. In a gaseous form like this, you could use it as a sterilant as well. If you use it in its liquid form, it's about the exposure time. Depends on the author. Typical time, as little as 3 hours, as much as 12 hours. Average is about 6 to 10 hours. Like you saw for the glutaraldehyde, cold liquid sterilization, even with dilute Clorox. What they don't do here, and I'm not criticizing, because it's time consuming. If you want to have maximum activity, which we really don't need in the lab, we're using it more for a disinfectant than a sterilant. That's another solution that after 24 hours you should change out. It's cheap as chips. I mean, it's not expensive. Okay. Typically, it's about, if you buy the Clorox, it's like 6 or 7%. If you get the liquid for the liquid chlorine for the pool, and you get the good stuff, it's about 10%. And that's a little more expensive. A gallon of that is, less than $4. So it's inexpensive, even the good stuff. So that's a big player, which brings us surely the most commonly used one. I literally grew up on this stuff, and that is iodine. The saga of iodine. When I was a little kid, your mom used to chase you around when you cut your knee and scraped your knee with something called tincture of iodine. It had the skull and crossbones on it because it stung like hell. Moms did. Under penalty of death. My mom was no different. We were all like that. So what the big problem with iodine, even in that form, and it was a wonderful antiseptic, was that it was released so quickly that it burned. So what they did was they took a protein carrier called povidone and mated it with iodine, and voila, which now you get generically, betadine. The protein carrier released it more slowly, so it didn't sting. That's the good news. Is betadine a panacea? No. It's better if you dilute it. Once you dilute it, particularly when you make it with soap, now you have an agent that's suitable as an antiseptic, like chlorhexidines or biguanides are, to use as a sterilant and for surgical scrubbing. It's a good thing. If you dilute it, and years ago we used to use it as an ointment or using it as a soap, it's wonderful skincare for wounds. The problem with full strength betadine, now preoperatively it's great. So we use betadine solution, you put it on an area. The only difficulty is that it causes a certain amount of brownish staining. You can take some alcohol and get rid of the color that's on that. We used to do that all the time, or sterile water, because color is important when you're looking at a post-operative site. And so utilizing that, very, very effective. For years, we incorporated it in dressings. The trouble with it being incorporated with a dressing is it dries, would adhere to the surgical site or to wounds, and when you pulled it off, we used to call them betadine wet to dries. They use the same thing still today called saline wet to dries. It's medieval torture because inherently it is cytotoxic. So those new baby cells that are trying to heal the wound, they're just starting to grow, and then you're more. Wound care today is more about keeping things moist rather than keeping things dry. So they've gotten away from impregnating, which we did. I mean, we'd put betadine on the non-adherent gauze. We put betadine on the gauze. It would dry like a cast, which was great. The trouble was that if you were dealing with wound issue problems, it was problematic. So the iodophore is effectively what that povidone iodine is. Originally used as a tincture, the protein base releases from which is the carrier molecule, less irritating. Bad news, certain very resistant agents, and Pseudomonas is a big player in this, as I've commented on before. You'll get sick and tired of hearing about Pseudomonas aeruginosa because it's a common soil bacteria. It's in all the hospitals because it comes in on your shoes. It's why you don't bring live plants in anymore. Most places are resistant because it's in soil. And most of us have it on our skin anyway now, just from being exposed to it so much. And what does it do? It creates. It is very, very hard to find not just an antiseptic or disinfectant, but antibiotics. It's a real pain in the neck. It's one of those like, ugh. And it has a rather unpleasant odor. It's almost like a sickeningly sweet kind of a smell. It smells a little like grapes, and it turns colors as well. And as you'll see that in the laboratory, when you use it in the lab, you'll see a discoloration, typically greenish, that goes along with Pseudomonas. I have some good pictures of that as well. So that's the good news and the bad news. When it's diluted appropriately, typically if you want to soak people in betadine, the best way to do it is to take sterile water and pour some betadine in it. So about a 1 to 10 solution is very useful for wound care, but full strength is not. Why not? Metals. Okay. So metals act very specifically to denature proteins. They interfere with sulfhydryl groups. Okay, sulfhydryl groups, basically it interrupts the change when it creates those types of things. So it links them, they're called disulfide bonds. Too toxic to be used medically so we utilize them, as I'll get to, in creams and badges. We'll talk about the silver nitrate issue with gonorrhea, and we've used mercuric compounds, tin, gold, silver. Okay. First time they were used, they were early on, cavities were filled with gold and silver amalgams. And the reason they used that was because it retarded bacterial growth. So metals have been utilized for that. Now they utilize more non-precious metals, and now we're more into the cosmetic aspects of dentistry. So you're using substances that don't look like you eat a mouthful of gold or silver or metal. Okay? So it's, the cosmetic aspect of it has changed. So they went from precious metals to non-precious metals. When I was a kid, you had this thing that was shaking it around to make little bits of silver, because I was even past the days when they were using gold. That's what, they did. I hate to go all Holocaust on you. They were, picking gold out of Holocaust victims' teeth, melt down into gold ingots. We clear is what was going on. So moving on with regard to that. Utilizing silver was certainly the most common of these, and to some extent still is. For years, a chemical that most of you used in a chem lab in high school called silver nitrate. What was neat about that is if you put something with chloride in it, it would precipitate. So it was a very useful demo for things in the lab. It also, if it got in your skin, it turned it black. Okay, it discolored the skin, the product that it made when it got into your skin. For years, until we used topical antibiotics, babies that were born had drops put in their eyes to prevent gonorrhea, because gonorrhea was rampant and would lead to blindness. And we didn't have the ability to monitor or test for that very efficiently. And every state in the union still uses antibiotic drops immediately after birth to prevent sexually transmitted disease, probably more problematic with chlamydia today than anything else, but still gonorrhea is present. Okay. The trouble why they got away from it favorably was because the little baby came out with black eyes, and parents were nuts about that. Okay. That's how it started. So silver nitrate's been around. I used it clinically because it got rid of something called proud flesh, which is granulation tissue that sometimes occurred in wounds. So it was a useful wound care. So I have a lot of experience using it. As I said to you before, if there's one best thing, everybody uses it. The best topical agent to use for burns to prevent infection, Silvadene cream. Been around forever, stood the test of time. They're oil we used to use. So it's a combination of silver salts in a sulfa-based agent. It comes from sulfa drugs. It's one. Never going away. Silvadene cream is the best stuff around. Topical agents for burns, wonderful topical agent as a generic antibiotic as well. Not so much as a prescription item that's utilized. Okay. So that's important. So metals are important historically. The other metal and the other agent that was around at the same time Mom chased you around with tincture of iodine was another tincture. Tincture of merthiolate. Red in color. When I started as a resident, it was still being used as an agent to prep the skin. The surgeon who was the lead surgeon in the hospital eventually named only used merthiolate. The trouble with merthiolate, it stained the skin red, and red is a color that you can't deal with because you can't see inflammation or infection early on. No one was going to tell him what to do. So tincture of merthiolate. So mercury-based compounds have been used for a long period of time. They used to use mercuric vapors in the late 1800s for syphilis, in the hopes that they could rid people of syphilis when they start to get secondary syphilis, which were highly toxic in any event. Here's the big player. Mercuric compounds are also preservatives, and the most infamous, who's still used, is this: thimerosal. Thimerosal is a mercuric compound and had been used as a vaccine preservative forever. The problem is, and it's a twofold problem. About 20 plus years ago, some research was done in England that pointed to the enormous uptick in the diagnosis of autism and autism on the spectrum disorders of autism, and associated them with thimerosal-based immunizations for babies. Everybody went nuts. Okay, it set the anti-vax community on. The idea was good. The research was bad. The research was shown to be inaccurate and poorly done. So it was published by major journals in England, major medical journals, but found to be inaccurate. So it was not valid. And so this is the problem with it. And so ever since then, the vaccine community says there's never been anything shown to prove, and they're right, that thimerosal causes autism. The counter to that, we have never disproved. The fact that you didn't prove something doesn't mean it doesn't exist. Okay, there's no proof that it does, and there's no proof that it doesn't. There's a big we don't know. And so I would encourage you to when you have kids, to have them vaccinated. I would encourage you to vaccinate them with thimerosal-free products. They are there. They don't cost any more. If the doctor says to you, well, they've never proven that, the counter is A, they've never disproven it, and B, there's a zillion other doctors. You can go anywhere today. There's more doctors than you think, and they want you as a patient. So you have the power. Tell them what to do. If somebody's doctor says, I won't do it that way, fine, I'll get another doctor. If you and the horse that brought you. You may not want to say it, I'll say it. Tell them Dr. Stein said to say it. That's my 2 cents. I don't want to be preachy about it. It's a personal choice. I recommend it. The biggest recommendation anybody can give, when my daughter had her daughter, that's what I told her to do. When my son and his wife had their 2 children, two kids, that's what I told them to do. So you can take it for what it is. It wherever you fall and what you're comfortable with, I think you should do. Okay, because I think there's a big problem with vaccine laxity. Like I said, measles is resurgent. It's because people have been lax about vaccines that have been effective over the course of time. Okay. That's my own opinion with it. And so I'm fond. My idea of teaching, scientific teaching, particularly in this sense, is to give you the information, and you have to make your decision. That's what life is about. Be informed, make the decision that you're comfortable with, whatever that decision is. Almost done. Ozone. This is another one of those interesting agents for water purification. So you generate it, but it decomposes. It's a great oxidizer. This is being used extensively, wastewater treatment and drinking water treatment, because things that evaporate, they're environmentally friendly. The trouble is, as an oxidizing agent, you have to be careful with it. So it can impact you if you're in close contact. That's something. Maybe my favorite category, peroxygens. That's where our old buddy hydrogen peroxide is. It goes back to what we just did in the previous chapter. Superoxide dismutase and catalase. The utilization, okay, of those agents to get rid of toxic derivatives of oxygen. Well, hydrogen peroxide is a toxic derivative of oxygen. It's really significant. The good news, biodegradable, no residue. A lot of gyms were using one I was going to. I know, you don't believe it. Don't start just because you're skinny and I'm not. No, don't want to hear it. Remember I told you, get in shape, round is the shape. Never, what they were using was hydrogen peroxide with orange oil, like the stuff that you see in a lot of detergents. Okay, biodegradable. A lot of old people were at that. It was a gym that had like a silver sneakers program, so a lot of older folks. You don't want stuff that has bad fumes that are there. Less toxic than ethylene oxide and glutaraldehyde. It is a sterilant. Okay, more effective on inanimate objects, but we can use it particularly in its diluted form for wounds, and you can cleanse wounds in its concentrated form because then you're looking for its antibacterial effect. Okay, in vapor phase, meaning very, very hot concentrated solution, that's the sterilant for those containers for the juice boxes and things like that. So it has a lot of usage that are there. This one is relatively new, peracetic acid, presence of organic compounds, no residue, lots of materials. So different agencies are using it. It's something like this that they're using a little bit more in those like those suitcase systems to now sterilize endoscopes and colonoscopes and things like that. That's where it comes from. I think they used to have a picture in this other PowerPoint of that system. I'll see if I can find that for you. So I think that's another really, really good one to utilize. The nugget I would share with you is when you initially treat it full strength on a wound, you're doing it to get rid of contamination. If it's a wound that's healing, again, it's cytotoxic. That's what full strength betadine is. So you have to dilute it if you're going to use it topically for wounds that are slow healing and you're in a wound care program that are there. I'll stop here. We'll get to phenolics require a little bit more time, and because they've been around for so long, and then the quats, and then we're basically done with most of this. So we'll finish this up. Exam Wednesday. Be here. I get in here early. There's nobody in the room. I'll try to be here by about 8:30 to get started. If you want some extra time, come in. Join us early.